According to WHO, there are 360 million persons in the world with disabling hearing loss. Disabling hearing loss is defined as adults 15 years and older hearing loss greater than 40 decibels in the better hearing ear, and children 0 to 14 years of age hearing loss greater than 30 decibel in the better hearing ear. International Week of the Deaf starts in the last week of September and ends on the last Sunday of the month. This last Sunday is known as World Day of Deaf. This day is celebrated to draw the attention of not only affected people and their family members, but also to draw the attention of general people, politicians, and development authorities towards the achievements and challenges of the deaf community. We at MediCircle are conducting the World Day of Deaf Awareness Day series to create awareness on prevention and control of hearing impairment. Hello, I'm Aprajita Mehra, and today our guest for the talk is Dr. Neepa Vellimuttam. Dr. Neepa Vellimuttam is practicing as consultant ENT and head and neck surgeon at SL Raheja Hospital, Mumbai. Her expertise lies in otology, rhinology, pediatric ENT, laryngology, head and neck surgery, and maxillofacial surgery. She has won the first prize for paper titled Endoscopic Surgery in Carcinoma of Larynx in the research meeting held at Bombay Hospital in November 2008. Welcome to MediCircle, Dr. Neepa Vellimuttam. So lovely to have you here, finally, on this session of Dr. Speak.
Thank you, Aparajita, for having me.
Welcome again. My first question to you would be, Doctor, that what are the causes of deafness?
Okay, so deafness can be caused by a variety of reasons. So we characterize deafness into mainly two categories. One is congenital and the other is acquired. Congenital, that is children who are born deaf. This is due to non-development of hair cells inside the cochlea, which is the ear organ, which is not working properly for the hearing. And acquired can be due to a lot of reasons, such as aging, some infections in the ear, trauma, or tumor.
Right.
Deafness can also be classified as two types, sensorineural and conductive deafness. Sensorineural deafness is one in which the hearing nerve and the nerve elements are not functioning adequately. And conductive deafness is one in which there are certain conditions of the ear, such as infections in the ear, which is giving rise to some perforation of the eardrum, presence of cholesteatoma in the ear, or just presence of simple wax can also reduce the hearing.
Right.
Now, the most common cause of deafness is age. Aging causes degeneration of inner ear structures as time progresses. So this is the most common reason of deafness we see in our day-to-day life.
Right.
Other conditions causing hearing loss are chronic ear infections, giving rise to perforation in the eardrum, or chronic mastoiditis. Other causes can be use of ototoxic drugs. Some drugs are famous for causing hearing loss, such as gentamicin, streptomycin. So when doctors prescribe these medicines, generally we do tell the patients that you might suffer a hearing loss in a course of time, and we counsel them adequately. Even exposure to loud noise can lead to deafness. There is some occupational reason. People who work in situations where there is continuous exposure to loud noise can also face deafness. There are certain hereditary causes, some genetic causes, which are more rarer causes of deafness.
Right.
And yes, and there are other reasons such as viral illnesses can cause deafness due to the damage of the hearing nerves, the outer hair cells inside the cochlea. And very rarely, some certain brain tumors such as vestibular schwannoma that can also lead to deafness.
All right, those were the quite some major and minor, reasons of deafness. So ideally, doctor, when would be the right time to consult a doctor in case of any ear problem that I feel?
Yeah, so you should consult an ENT specialist whenever you're facing problems such as ear discharge, or chronic ear pain, even headache on one side of the ear. You should consult your doctor if you are having some infection. If you have an ear infection and the ear infection is treated at the right time, your hearing won't be affected. However, if the infection is left untreated for a long period of time, the hearing can be damaged permanently to a certain extent. Also, you should meet your ENT specialist as and when you observe that your hearing in one ear is lesser as compared to the other. So I would suggest that whenever you have even a certain doubt, even if you have a symptom of some sound coming in your ear, it's better to consult an ENT specialist because there are treatment options for each and every ailment, and we can tackle them if the patient comes to us at the right time.
Wonderfully explained. And actually, I think all my audience who are connected through MediCircle with us right now should definitely follow and take, advice of you and go and seek a ENT specialist nearby. So any traditional remedies for ear problems, doctor?
Yeah, there are quite a few traditional remedies. I'm sure all of us, we have heard from our parents, from our grandparents. One of the commonest which we use is the garlic oil. Garlic has very good antimicrobial, antiviral, and antifungal properties. So garlic usually helps if you have an external ear infection. The other traditional remedy is using oil for wax. So basically, oil is a lubricant. So when we put oil, it should be sterile oil. If you put oil in your ear, it helps to soften the wax and self-expulsion of the wax. The other traditional remedy is steam inhalation. So you must have observed when you catch a cold, when you have a simple cold, your nose is blocked, your ears also feel blocked. You feel your hearing has
yes, we hear that kind of
you feel
inside.
everything is echoing.
Yeah, absolutely true.
Yeah. So why does that happen? That happens because there is a eustachian tube. There's a tube between the nose and the ear. So when you have too much of cold, when your nose and your sinuses are blocked, the eustachian tube gets blocked and you feel that sensation of blocking and clogging in your ears. So the best way to get rid of that is to take steam. Steam helps to open up the passages inside your nose and sinuses and helps to prevent infection from furthering spreading into the ears or accumulation of fluid into the ears. When you catch a cold, you don't want that to happen. Yeah, right. And when you have severe ear pain or ear infection, you can use some hot compresses, hot pad, and apply on the ear. That can relieve pain to a certain extent. But definitely, these are traditional remedies. But definitely, I would still suggest you meet an ENT specialist because the cause of the ear ailment has to be tackled, has to be diagnosed and treated as soon as possible.
Right. So well spoken that absolutely the diagnosis of a disease is primarily more important than actual treatment of it. Yes. Because the quicker and earlier we diagnose a thing, it is better for the doctor to actually take find the right cause and root of it.
Correct.
And then correct it.
So I get a lot of especially during the lockdown, we have been doing video consulting. So I have been getting a lot of calls and a lot of video consultation from patients who say that I have pain in my ear. What drops should I put? And I always tell them it's very important that you show yourself to an ENT specialist because the cause of the pain can be anything. It can be simple wax. It can be just an outer infection. It can be just a boil in your ear, or it can be a fungal infection. It can be a bacterial infection, or it
could
can
be just water. Or it could be just simple water.
It can be just water inside
while
your
shower or whatever.
Middle ear. So it's better, and each ailment has different drops and different treatment. So I would always suggest the audience, whenever you have a ear problem, please meet your ENT specialist and get it tackled and get it diagnosed correctly first.
So I would address this to our audiences that in case you are hearing and viewing us now, then kindly do, like, follow, subscribe us for at MediCircle, because here you have such accomplished doctors telling you exactly what to do and not self-diagnose yourself. Don't treat yourself, on your own, and pay attention to the doctors that are speaking here at MediCircle. So my last question to you would be, Dr. Neepa, that what are the treatments available for hearing loss, if there are any?
Yeah. So hearing loss, deafness is the treatment. There are a lot of treatment options, and the treatment depends on the cause and the type of deafness, as I discussed earlier. So if it's an age-related deafness or a sensorineural deafness where the nerve is not functioning properly, the treatment that we recommend is usually hearing aid. So there are many types of hearing aids available. There are different brands of hearing aids available in the market, but it's very important to know that the hearing aid has to be customized for each and every patient. You cannot use a hearing aid which is being used by your partner or by somebody else. Okay, because every patient has a different hearing threshold, and the hearing aid is fine-tuned as per the residual hearing that the patient has. So that is related to sensorineural deafness. Conductive deafness, which is caused by ear problems such as chronic ear infections or perforation of your eardrum or cholesteatoma, they are treated by treating the primary disease, and in certain conditions such as perforation of eardrum, surgery is required. So surgery will definitely improve your hearing. Now there is another condition called otosclerosis. This is usually seen in women. Even men get affected by this. So in this condition, what happens? The hearing bones inside our ear, they get fixed. They do not vibrate as they are supposed to. And that stops the transmission of the sound waves into the inner ear. So this condition requires a surgery called stapedectomy, where we replaced the fixed bone by a piston, which then does the job which was supposed to be done by the ossicle, and it vibrates and it transmits the sound waves to the inner ear. So the treatment of each and every condition is different. The most important I would right now like to discuss is congenital deafness. So the treatment of congenital deafness is cochlear implant. When a child is born deaf, the child should be implanted before the age of 7 years. If the child has been given a cochlear implant before the age of 7 years at the right age, there is good development of hearing as well as speech. If the child cannot hear, the child won't be able to speak. So that is very important. And it's very important to know that it has to be done before the age of 7 years. If you delay it beyond that, especially if you delay it after 10 years, even if you implant the child, it's not gonna help the child because the brain has certain capacity to learn. After the age of 10 years, the brain will not be able to comprehend or interpret the sound stimulus which is being given by the implant. It's very sad to know that in India, still people are unaware of the concept of cochlear implant. Still, we see a lot of people in interiors of our country that they are not aware of such a technology which is available for their child. And what happens is if they cross the age of 7 years, then nothing can be done for their child. So that's very important to know. And I would like to take this opportunity which you have given me to spread the awareness of cochlear implant as well as our latest technology, which has helped us to provide the best hearing to our patients. As I tell all my patients, I tell everyone, I always feel hearing is a gift from God. And if hearing is affected, your quality of life is affected. So please meet your nearest ENT specialist for the best treatment option available. There are latest technology available, and there is treatment for each and every condition. Yeah.
Wow, that was a fantastic message and a very sensitive one too. Dr. Neepa, you have so beautifully summed up our, day's awareness and everything. Everything about the topic you have covered so beautifully, and especially the fact that you have just told our audience that it is extremely crucial for a child to get this kind of treatment before the age of 7. So ideally, the message for this special day should be that the children be diagnosed as soon as they are born, or there was vehicle passing by. You could hear it now. I'll repeat this line. Yes.
Yeah.
So the fact that we should ideally, the moment the child is born, there should be some provision, some way to get them tested immediately so that the sooner we realize that they need some treatment, it could be provided to them. So I'm so glad and so thankful that you connected with us today. And through you, we got to know so much about this Day of Deaf. So thank you so much for coming on our show and sharing your valuable time and insights with us at MediCircle. It was really a pleasure having you here. Thank you so much, ma'am.
Thanks a lot. Yeah, thank you.
Thank you.
Bye.